Hi, my name is Dr. Hillary Knight. I am a dentist in New Buffalo, Michigan, and today's webinar presentation is on craniofacial sleep medicine. It is an area of dentistry that has become very intriguing to me and I think can benefit a lot of people. There are multiple reasons why one would undergo treatment for the craniofacial region with a growth appliance. One of them is to help you with sleep and breathing, so to treat obstructive sleep apnea. Another reason why someone might consider growth appliance is to enhance the mid-face region. Sometimes we like to refer to that as the non-surgical facelift. A third reason may be if the patient is experiencing some pain in their TMJ joint, that can also result from an insufficient development of the upper arch or the maxilla bone. And lastly, for aesthetics. So arrangement of the teeth. So in lieu of traditional orthodontics, this can be a method that's used. So I'm going to kind of start at the basics and then we'll get into a little bit more detail of what we mean when we're saying enhancing aesthetics. Okay, so the focus, of course, for Biomedic oral appliance and what it is FDA cleared for is to treat obstructive sleep apnea. So sleep apnea can result in a number of symptoms that many people don't even realize are related to sleep apnea. So if you look at this tree, what it's trying to portray is that these symptoms that are the branches, so fibromyalgia, headaches, hypothyroidism, depression, crooked teeth, obesity, cancer, hypertension, anxiety, dementia, aggression, ADD, bedwetting, can all be related to a disorder during sleep. So having that airway obstructed while you're sleeping can decrease your oxygen and can affect multiple parts of your body. And this is because that's a chronic deprivation that your body's undergoing night by night. And so a lot of people may have some of these symptoms and may not even realize what it's from. So what is a sleep-related breathing disorder? So to put it into multiple words here, sleep-related breathing disorders are conditions of abnormal or difficult respiration. And that happens when a person's airway becomes partially or completely blocked many times during sleep. So what happens is that instead of having a nice sleep cycle where you get to the stage 1, 2, 3, 4 and REM sleep, you keep getting woken up in between by those interruptions in your airway when the airway is blocked. So people with sleep apnea, because they're having these little interruptions, and it's not interruptions that the patient's aware of. So let's be clear about that. It's not like you wake up and you know, okay, I woke up because I stopped breathing. Usually the patient does not know that they're not breathing. They don't remember that they were woken up out of their sleep cycle. They probably didn't open their eyes, but it's enough to take them out of that sleep cycle. So without getting into the deep sleep stages or not staying there long enough, they don't get sufficient or good quality sleep. So they may feel sleepy or fatigued the next day. And that's when you start to feel some of those other mental side effects like aggression or anxiety or depression. Okay, let's show you what the picture looks like. So this is a great illustration of what can happen. And you see here, this person has an upper arch here. This is the bone of the upper arch holding the upper teeth and the bone of the lower jaw holding the lower teeth. And there's a soft palate hanging down here too. Some people have an excess of soft tissue, and that can be more prevalent in people who are overweight, but certainly anyone can have a long, soft palate. And then here, this person's tongue, you can see that their mouth is open. The tongue is not resting on the roof of the mouth. It's hanging low or hanging without support. And so as that person is sleeping, all their muscles are relaxed. The tongue is a big muscle too, so it also relaxes. And it can fall into the back of the airway and block off the airflow, either partially or completely. So there's a different scale of what kind of blockages you can have in your airway. Some people have a very mild blockage and they snore, but they don't have a diagnosis of obstructive sleep apnea. So not every snorer has sleep apnea. However, about 95% of patients with sleep apnea do snore. So there is some correlation there, but it doesn't mean that you have sleep apnea just because you snore. And then there's a gradient here. So there's upper airway resistance syndrome and sleep apnea. Sleep apnea has a very scientific diagnosis where you do need to stop breathing for over 10 seconds. And that's measured in how many times does that happen per hour. And so down here you can see if your AHI is less than 5 incidences per hour, they consider that you don't have sleep apnea, even though you did stop breathing a total of 50 seconds during that hour. You know, I would still think that that is could have some impact, but in terms of diagnosis and treatment, we call that no sleep apnea. And then it goes to mild, moderate, and severe. Upper airway resistance syndrome is a more mild form of sleep apnea. So a lot of times in women, especially, they may not have the full 10 seconds where they stopped breathing, but it's 8 seconds, or it's, you know, multiple times per night at just under 10 seconds, and it's still affecting their brain chemistry and how they feel the next day in their body on a whole, but they may not have the diagnosis of sleep apnea because they may not qualify for that whole 10 seconds period of stopping breathing. Which I still think is very important to treat and to know about. And so our sleep tests do look for interruptions in breathing that are less than 10 seconds too. So here's a kind of a cute little illustration, if it can be cute, of the different symptoms that can happen when a person doesn't get good quality sleep. Now, this can be for many reasons. I mean, if you don't sleep enough hours, you can have some of these symptoms too. But we're talking about, you know, people who do get their, you know, 7 to 9 hours of sleep every night, and they still wake up feeling tired during the day. They may have morning headaches, trouble concentrating. They may be really irritable. They may fall asleep during routine activities. And then at nighttime, they may notice they have to go to the bathroom a lot more. They may feel like this guy's wrestling an alligator, that their sleep isn't restless. They may wake up choking or gasping for air. Their spouse may actually witness them stop breathing, and they could have really loud snoring. So we're talking about snoring that you can hear through a door. There's definitely an obstructed airway in that instance. This is a wonderful YouTube video by Matthew Walker that talks about why we actually sleep, why it's important. And his main point is that while you're sleeping, during your sleep cycle, one of the things that happens is that your brain sort of cleans out or filters out build up byproducts from the day. And if you're not getting into that deep sleep cycle, you essentially have buildup there. And some people kind of notice it as a mental fog, or they're not as clear. Some people actually do have memory problems, and it's because of the accumulation of those chemical byproducts in the brain. We kind of went over that, so we'll skip ahead a little bit more. RDI is back to, again, those instances where, you know, it's not a complete event where you're stopping breathing. But all of these instances where the oxygen level is decreasing, we rate in a sleep test. And so oxygen desaturation can occur where, you know, it's a mild desaturation, anywhere to, you know, here the severe scale is below 80%. Just so you know, if you were in the hospital and you went below 90% oxygen saturation, that would be a big deal. You'd be put on oxygen. So this is happening to people at night, multiple times a night. So what does that do to the body? Back to this picture. A lot of different symptoms here. It affects the whole body. One of the big things is a weakened immune system, especially now during coronavirus. It's important that your immune system is functioning to its peak. And people who do breathe through their mouth, or they snore at night, or they know they already have obstructive sleep apnea, are more at risk for bigger problems when they do get infected with a bacteria or a virus like coronavirus. Heart problems are also really highly correlated to obstructive sleep apnea. Diabetes, and especially if someone's been you know, working really hard on weight reduction and eating healthy and they're still not seeing results, I would always recommend that their sleep is tested, because it may be impacting how well their body's regulating the blood sugar. And everything in between here, you know, I don't want to repeat myself too much, but there are many body systems that are affected when somebody is not breathing well at night. So why do we want to breathe through our nose? You might think, well, okay, if I can get air through my mouth, it's the same thing, right? You know, if my tongue's not falling back there, if I could find a way to get my tongue forward, why does it matter if I breathe through my nose? And so I think it's important to review why nasal breathing is important as well. Simply, first and foremost, your nasal passage warms and humidifies the inhaled air, and it filters airborne particles. So when people are breathing through their mouth, especially children, you'll see that the tonsils can be really swollen. And that's because the tonsils are now doing the job that the nose was supposed to start doing initially. The other big thing is that the oxygen and CO2 levels may not be balanced. When you're breathing out through your mouth, you're blowing off more carbon dioxide. Without carbon dioxide, the red blood cells that are trying to deliver oxygen to the tissues won't offload the oxygen. So it'll stay stuck to the hemoglobin and it won't go into the tissues where it's needed. So everybody thinks oxygen is super important, which it is. But it has a high affinity for the red blood cells. And without that carbon dioxide there to help make the exchange, you just have a bunch of oxygen circulating in your blood and not getting to the tissues it needs to be in. So you want to breathe through your nose so that you're not blowing off excess carbon dioxide. The other thing is that nitric oxide is a vasodilator, and it is only produced in your paranasal sinuses. It is important for lowering blood pressure, boosting the immune system, improving exercise performance, increasing brain function, fighting erectile dysfunction, and can have a lot of impact on many other health issues that are related to blood flow because that nitric oxide is that vasodilator. Of course, as a dentist, I would always mention too that breathing through your nose improves your oral health. Especially in children, when I see that they're mouth breathing, their incidence of decay goes way up. So if mom's saying, how can this happen? I brush his teeth every night. We hardly ever have fruit snacks or ice cream. Like, how did this happen? I would suggest to look at their breathing. So that dryness can affect the pH of the mouth. And anytime there's an acidic pH, we're more at risk for decay and periodontal disease too. Bad breath can also become more apparent in someone who's not breathing through their nose. And then, of course, you want to breathe through your nose to prevent dry mouth and nasal decongestion. So, excuse me, nasal congestion. That's a typo there. So if we're over breathing or blowing out through our mouth and not breathing through our nose, the body's actually going to produce more mucus. So it makes it harder to breathe through the nose. So it's important to break that cycle, and sometimes that can be a little difficult, but there are ways to do that with simple over-the-counter saline sprays and such, so that you can start breathing through your nose and stop that cycle. Okay, so there's a variety of different treatment modalities for obstructive sleep apnea, including the CPAP machine, which most people are aware of and not super excited to get started on. They do work if you're using them every single night. They do not treat the underlying issue. A mandibular advancement device can also be a possibility. We do make those at our practice, and it helps to position the mandible a little more anteriorly. Again, that helps to reduce the chance that the tongue is going to fall into the back of the airway. It does not address the root of the problem, though, either. Some people can have some TMJ discomfort with that appliance as well. And then the last thing is a biomimetic oral appliance. And that is something that's different than the other two options because it's actually treating the root of the problem, which is an upper jaw that is too small to properly house the tongue in a good suctioned position. This is my little friend here. And as you can see, the maxilla makes up quite a large portion of the midface, basically the whole midface. It includes the upper housing, the housing for the upper teeth. It also includes the floor of the orbit under the eye, and it goes up to the side of the nose. And it includes all of the side walls of the inside of the nose and the floor of the nose. Okay. CPAP. Okay, this is a mandibular advancement device. So you can see how it's pulling that lower jaw forward so the man can breathe. Okay, and here is someone who has had biomimetic oral appliance therapy. First, she tried a mandibular advancement device. That was her cast, that she started with, and then 10 years later, you can see the teeth are about the same. her AHI has gotten worse. So she's relying on that mandibular advancement device. And now she's stopping breathing for 10 seconds at a time, 68 times per hour. So you can imagine she is exhausted. She tried the Biomedic oral appliance, and it looks like she just had it for about 10 months. And it widened her arch enough that she could properly place her tongue. And with no device in the mouth after that amount of time, her AHI went down to 12 times per hour. So that's pretty incredible. So with the oral appliance therapy, we're really doing something called pneumopedics, or remodeling the airway itself with that appliance. This is what the appliance looks like. It's kind of a retainer style. And these little springs here in the front do the magic. They lightly touch the backside of the anterior teeth enough to stimulate the stem cells and the periodontal ligament that's holding the tooth in the socket. And what that does is it sends a signal to the body that the tongue is there. And so it's kind of mimicking what the tongue should have done originally to help develop the jaw. And that signal then tells the body to lay down more bone. And so you get a development of bone in the whole maxillary arch. That signal is telling this whole bone to grow, to develop. And so you get more space for the teeth, of course, you get more space for the airway. And something else that you'll notice is that the floor of the nose will drop and broaden, so it's easier to breathe through your nose. And these cheekbones come out and get a little more pronounced. Here's the appliance that's specifically made for people who do have obstructive sleep apnea. It will help to pull the tongue out of the airway, similar to a mandibular repositioning device, while the patient is developing their upper jaw. So this appliance uses activation of your epigenome, the part of the gene that turns on or off or modulates how a gene is expressed. So we're not modifying the genes, we're just turning on the genes that are already coding for the development of the maxilla. So here's a study. They used 15 adults that had severe OSA, and AHI prior to the study was a 4.9 per hour, and a follow-up at just a little under 10 months later showed a 64% decrease in AHI. With no appliance in the mouth. So again, these are lasting changes that you're making to that maxilla. This is how the airway can reshape itself. So on the left, you see a constricted airway, and on the right, you can see that we've opened up a lot more space here. And this is after 15 months of treatment. The AHI went down from 24 times an hour to 2.8. So went from, having a moderate OSA diagnosis down to no diagnosis. Remember, under 5. Just a different lateral view. And here's another view, like if you had sliced the skull this way and you were looking at the diameter of the air pipe here. So you can see how it has changed. And the cool thing about modulating an airway is that a small change in volume can have major impacts on efficacy. So, imagine trying to breathe in through a little coffee straw, and that would be really hard to suck air through that, versus, having one of those large bubble tea straws. You can suck all the air, in really easily with that, with little effort. So small changes to the airway equal big changes in air volume. And this graph shows that again. So before is that red zone. So it's looking at cross-sectional area of the airway. So here's a patient who underwent biomimetic oral appliance therapy for OSA. However, she also had some aesthetic outcomes too. So you can see in the initial picture, she's got a very gummy smile, lots of gum display. And over time, as she's developing, that upper arch is widening and broadening, her cheekbones are coming out, and now you don't see all the gum display because the arch has grown more forward and up and out broad, okay? When you see that gummy smile, that's a sign that the arch is growing kind of down in this clockwise position. So it's a more narrow form, and it's not as doesn't have as much room for the tongue. So again, showing some of the dental changes that can take place in a short amount of time. These are two different patients. You can see this patient presented with a lot of crowding on the upper arch, and after treatment, she gets all that space back where she had a premolar extracted, probably for orthodontics, thinking she didn't have enough room. Well, she didn't. You know, the jaw was too narrow, but as that palate develops, and you can even see here, it's really a high vaulted palate, and here it's more broad and flat. She's got a lot more room for her tongue. She'll probably still need a little bit of light orthodontics to realign these teeth for aesthetics, but breath is much easier to come by now. And similar here, you know, this is a patient who had orthodontics. They had their premolars extracted, and everything's pretty, it's well aligned, but there's not enough room for the tongue, and that mid face is probably really flat. We could see that too. So, you know, here there's some definite changes to the arch form. All of these teeth have moved out more broadly, and even the front teeth have moved posteriorly. They move with the bone, so it's not just tipping the teeth and putting forces on the teeth. Like traditional orthodontics, you're actually growing the bone and the teeth move with it. So pretty cool stuff. Here is another good example of what can happen with a biomimetic oral appliance that is helping breath, but also facial features. So here's how she started, very crowded in the front, very narrow arch with a high vaulted palate. And at the end, we can see that the palate is much more broadened and flattened. From a side view, you can see here that her jaw is retrognathic or retruded. And in the final picture, you know, you can almost draw a straight line from right between the eyebrows to her chin. So very well defined. You can see more definition in that mid face and that cheekbone area. We look at this angle to be obtuse or a wide angle, and now here that labial mental angle is closer to 90 degrees. So much more aesthetic improvement. And from the front, you can see that her face is more narrow here. And then at the end, her arch is wider. The cheekbones have widened as well and come forward a little bit more. And it's a beautiful result. So not only did the teeth turn out much straighter in the end, but the facial features are definitely enhanced as well. Another example, so this is a patient who had trouble with sleep, and that was her primary reason for doing the appliance. But you can see she got a wonderful aesthetic result in the end. Almost, you almost have to wonder, is it that same patient to begin with? So here she's very narrow in the maxilla width here. And as the arch developed, and I say arch, but I really mean the entire maxilla bone. So as that's developing wider and broader and more forward, she's getting that lift in the cheekbones here. And the width too, you know, more of a round face appearance than a long, narrow face look. Okay. It was a patient who, you know, had great facial features to begin with, but she was tired all the time. And so she did biomimetic oral appliance therapy and really improved that look of, you know, the dark circles under her eyes that she started with here. And also, again, brought the cheekbones wider and more forward, a much better balance to the face. And this was only after 3 months of treatment. And the side profile, I think, is really good to see too. So, you know, you can see here the chin is retruded, a wide mental labial angle. And here it's a nice, you know, forward chin, almost a 90-degree angle here. You could probably draw a line right from the eyebrows to the chin. So nice maxillary development. And just to kind of block out what the skin confuses us with, you know, you can see that profile a lot better when it's just shaded black. And aesthetics, you know, even just that small change has made her lips look fuller. Has made the nose fit her facial profile a lot better. And there, you know, you don't see that retrognathic retruded chin anymore either. So very nice result. And this is showing her x-rays. So you can see The plane of occlusion is not slanted or tipped like it is here. It's more flat. And the chin too. So the angle of the mandible here is pretty steep. And as that upper jaw is developing, the lower jaw is allowed to come forward into its more proper place. And you can see that now we have a more defined jawline here too. It's not just kind of melting in like it was in the first image. Okay, so just a refresher of why we're using an oral appliance, a biomimetic oral appliance, for treating sleep apnea, for TMJ problems, and that can also include tinnitus or ringing in the ears. The auditory canal is right behind the jaw joint, the TMJ. So here's the jaw joint and here's that auditory canal. And there are many nerves and vessels that are going in this area to innervate the ear. And if that jaw is retruded, the lower jaw is retruded from a smaller upper jaw constricting it, it can put a lot of pressure on those nerves, and that can cause some ringing in the ears. So many times, patients will say, well, I went to the ear doctor, there's nothing I can do. I would suggest they have a CBCT and see where that jaw position is, because if it is impinging on the auditory nerve, that could be a reason for the ringing. And then, of course, aesthetics. I have in here orthodontics versus orthotropics. And what I'm just trying to say is, orthodontics is focused on alignment of the teeth. We're looking at aesthetics just in regards to how the teeth look. With a biomimetic oral appliance, you're looking at full face aesthetics. So teeth plus, this whole mid-face region, that's the maxilla. So we call that orthotropics. And then, of course, functional discrepancies. So open bite, cross bite, speech. So, other reasons that you would consider a normal orthodontic appliance can also be a reason to do a biomimetic growth appliance if the growth has been insufficient. So here's just a look at that jaw joint a little more in detail. Here's the auditory canal of someone who had TMJ issues, and you can see here's a healthy TMJ on probably a training skull like the one I have, and you can see there's lots of space between the mandible and the auditory canal. In this patient, her jaw had been pushed back for so many years because she had restriction in how much space the lower jaw had to move, and so her nerves and vessels were impinged, and she had suffered from ringing in the ear. So this is that patient, and her tinnitus was completely restored after she used the biomimetic oral appliance. You can also see that her facial features have improved. The bags under the eyes are less. She's got a nice lift in the cheekbones, and she no longer has to do that forward head posture because she has an open airway and can breathe. So you see the forward head posture really noticeable in this first image. She's sticking her neck out so that she can open up that airway because her jaw's trapped so far back. Ear is way in front of her shoulder right here. And then after treatment, you almost see she's able to stand up a little more straight. It's hard to correct that spinal curvature that's been developed over years of poor posture, but even if you just look at the face, she's not tipping up, she's not struggling to breathe, she can have a normal position of her eyes. And they talk about the submandibular pannus has decreased. So that's this little area under the chin. A lot of times, people will think, oh gosh, I need to, lose weight. They lose weight, it's still there. It can be because they're posturing their head forward if their airway is insufficient. And this can be at nighttime too. And so one of the ways to reduce the appearance of that submandibular pannus is to look for OSA and to treat it with a biomimetic oral appliance. So another picture for the same patient, you can just see how her bite was off, slanted, and in post-treatment, that's corrected itself. And another example of facial asymmetry is in this patient. She started here with a very narrow face, and you can see as she's developing that these cheeks are appearing to be a little bit more broad. She's getting more of an oval face appearance, and here at the end, really nice balance and proportion. You no longer see one eye is higher than the other. They're more equal in appearance. So it can help with that asymmetry. And this is her CBCT. So they're superimposed before and after. So you can see that where she had that asymmetry, the blue areas is what it looked like afterwards. So that's a post-treatment. So, you know, the one side of the face corrected itself. And that's the beauty of this epigenetic appliance, is that, you know, you're not putting force on the body and pushing it into any direction. You know, we're not trying to use force. We're not trying to point it in one direction. We are just simply activating the gene responsible for maxillary growth. And that gene is encoded to be symmetrical. So if one side is off, it is going to self-correct. The beauty of it is that you're never going to have an overreach. You're never going to expand past where somebody is designed to be. The body wouldn't allow for that. So I think that's a really beautiful part about this kind of treatment. And, you know, you may be wondering, okay, well, it seems like there's a lot of people out there, if you start really looking at their cheekbones or at their profile, myself included, why are so many people having a small upper jaw? And it really relates back to early childhood diet and development. This is a drawing of the lateral view of a skull. And the important thing to take away is that by 4 years old, over 70% of the maxilla has been developed already. And so that early breastfeeding, eating foods that the child has to actually chew, good facial posture where the lips are together and the child's breathing through their nose are key in helping the maxilla develop. And this is a natural process. You can encourage a natural, healthy midface development simply by eating foods that you have to use your tongue muscle to digest, and by having proper breathing posture at rest. So with the advent of industrialized societies, we all ate pureed food as babies. A lot of us drank bottles as babies because our moms were at work. And so, you know, you can prove this philosophy. A lot of people tell me, well, it's probably because my mom had a small jaw, or my mom had braces. That's why I have braces. Well, maybe genetics can play some role into it, but it's pretty minor. And that's been demonstrated with anthropological studies. So Dr. Robert Corcini was an anthropologist who studied human skulls in isolated rural populations. And they all had similar teeth alignment, where all of their teeth came in, including the wisdom teeth, and they were pretty straight. And when he looked at those cultures, they all nursed, so they breastfed their children. When the children were ready to eat, they ate what their parents ate, just smaller portions, so no purees. And no, I don't have it on the slide, excuse me. In the first generation, they saw an increase of about 70% of malocclusion when soft foods were introduced, when an industrialized diet was introduced. So, you know, if you look at it, most malocclusion is not inherited. It takes about 27,000 years for a genetic mutation to express in 51% of the population. But if you can change the diet of a population, in just the first generation, the incidence of malocclusion rises dramatically. And so that tells you, okay, genes are playing a very minimal role, if anything, and it's more to do with form following function. Okay, so if you are interested in taking the next step and seeing if you're a patient who would qualify for a biomimetic oral appliance, we'd love to have you into the office. And what we would do is some initial information gathering. We take a scan of the teeth. We take photos of the patient's teeth, their face, their side profile. And we also have them get a CBCT image, which shows us the bones of the head and the airway space in 3D. So we can measure the airway space. We can measure where the upper jaw is in relation to the condyles and the TMJ joint. So we do that, and we also do recommend a sleep test if there are any symptoms where they may not be getting the type of quality of sleep that they should be. And all of that's put together in an airway intelligence report, and a treatment plan is worked up from there. So please let me know if you have any questions at all. You can reach us at an email address, team@harborcountrydental.com, or call us at the office number 269-469-3140. And I'm also compiling a YouTube playlist of many airway health related topics. So from early childhood development all the way through adult health. So please check out that playlist. You might find some good information there. And I hope we can help. Thank you for your time.